Gut decontamination strategy fails to save lives in ventilated patients, raising questions. A recent study has revealed a startling finding in the world of critical care medicine. Researchers from Australia and Canada conducted a randomized controlled trial to investigate the effectiveness of selective decontamination of the digestive tract, SDD, in critically ill patients on mechanical ventilation in ICUs. But here's the controversial part. Despite promising results in previous trials, SDD failed to reduce in-hospital deaths in this study. The trial, published in the New England Journal of Medicine, involved 26 ICUs in Australia and Canada, with patients randomly assigned to receive SDD, or standard care, for 2 12-month periods. The primary goal was to reduce in-hospital deaths from any cause within 90 days. However, the results showed no significant difference in mortality rates between the SDD and standard care groups. But why did this strategy fail? SDD involves applying a topical oral antibiotic paste to the oropharynx and stomach, along with intravenous antibiotics, to prevent lower respiratory tract infections caused by an overgrowth of bacteria and yeast in the upper gastrointestinal tract. While numerous trials and reviews have linked SDD to reduced mortality, its adoption has been limited due to concerns about antibiotic resistance. In this trial, 20,000 patients participated, with 9,289 in the randomized trial and 10,711 in a microbiologic assessment. Surprisingly, the SDD group had a slightly lower death rate, 27.9%, compared to the standard care group, 29.5%, at 90 days, but this difference was not statistically significant. And this is the part most people miss. The odds ratio for death in the SDD group was 0.93, indicating a small, but non-significant reduction in mortality. The study also examined microbiologic outcomes, finding lower rates of new bloodstream infections of 4.9% versus 6.8%, and antibiotic-resistant organisms, 16.8% versus 26.8% in the SDD group. However, the ecologic assessment did not confirm the non-inferiority of SDD in preventing new antibiotic-resistant organisms. Adverse events were rare, with 12 patients, 0.3%, in the SDD group experiencing them, compared to none in the standard care group. What does this mean for future treatments? This study raises important questions about the effectiveness of SDD in reducing mortality in critically ill patients on mechanical ventilation. While SDD has shown promise in previous research, this trial suggests that its impact on in-hospital deaths may be limited. The findings highlight the need for further investigation into alternative strategies to improve patient outcomes in the ICU. Tracking coronavirus vaccine development, a global effort. In the ongoing battle against coronaviruses, a powerful alliance has emerged. The University of Minnesota Center for Infectious Disease Research and Policy, CIDRAP, and the Coalition for Epidemic Preparedness Innovations, CEPI, have joined forces to create a comprehensive digital platform for the Coronavirus Vaccines R&D Roadmap, the CVR, initiative. This revamped website, as described in a University of Minnesota news release, aims to be a global, open-access hub for tracking the development of broadly protective coronavirus vaccines. These vaccines are designed to protect against multiple coronaviruses, including SARS-CoV-2, causing COVID-19, and MERS-CoV, causing Middle East Respiratory Syndrome. The platform offers 3 integrated components. Coronavirus Vaccine Technology Landscape, a curated database of coronavirus vaccines in preclinical and clinical development, including candidates targeting SARS-CoV-2 and MERS-CoV. R&D Progress Tracker, an interactive tool that monitors scientific advances and progress towards the roadmap's goals in virology, immunology, vaccinology, infection models, and policy. CVR Scholar Hub, a resource center featuring literature reviews and data syntheses to support researchers in coronavirus vaccine development. Originally launched in 2023, with funding from the Rockefeller Foundation and the Gates Foundation, the roadmap outlines key objectives for global coronavirus vaccine research and development. With CEPI's investment and collaboration with 50 global experts, the initiative aims to accelerate progress in priority research areas and catalyze coronavirus vaccine development, which is crucial for future pandemic preparedness. Knowledge is our greatest weapon against pandemics, said Nadia Cohen, PhD, CEPI's coronavirus vaccine program lead. By making scientific information on coronaviruses accessible to researchers and policymakers worldwide, we strengthen our defenses against future outbreaks. CIDRAP Director Michael Osterholm, PhD, miles per hour, emphasized the platform's real-time tracking capabilities. Our centralized resource allows us to identify progress and critical gaps in coronavirus vaccine development, enabling us to take swift action to address emerging threats. Measles case in Salt Lake County, patient refuses testing. In a concerning development, a probable measles case has been reported in Salt Lake County, Utah, where officials have been unable to confirm the illness due to the patient's refusal to undergo testing. Southern Utah has been the epicenter of measles activity in recent months, but Salt Lake County had not reported any infections until now. The Salt Lake County Health Department has identified a resident who is likely the area's first measles case, but the patient has declined to participate in the disease investigation. Without the patient's cooperation, we cannot technically confirm the illness or conduct proper contact tracing to notify potential contacts, said Dorothy Adams, MPA, Executive Director of the Health Department. However, based on the reported symptoms and our limited conversation with the patient, we strongly believe this is a measles case. Adams stressed the importance of cooperation with health officials, especially in measles outbreaks, where contact tracing is crucial to contain the spread. Utah has confirmed 59 measles cases so far this year, primarily in Washington County, where an outbreak in Hilldale has contributed to a southwest cluster with neighboring Colorado City, Arizona. Mental illness and long COVID, a troubling connection. A recent analysis published in JAMA Network Open has uncovered a concerning link between serious mental illness and long COVID. The study found that adults with schizophrenia, bipolar disorder, or recurrent major depressive disorder are at increased risk for long COVID, particularly those who are older, from racial or ethnic minority groups, have chronic conditions, have public health insurance, or hospitalized during infection. The research team, led by a Weill Cornell medicine investigator, conducted a longitudinal cohort study from March 2020 to April 2023, analyzing electronic health records of over 1.6 million COVID-19 patients, aged 21 and older. The study revealed that 15.9% of participants had a serious mental illness, and 24.8% developed long COVID. Those with a serious mental illness were at a 10% higher risk for long COVID, even after adjusting for various factors. The researchers attributed this increased risk to limited access to general medical care, treatment adherence challenges, and the presence of comorbidities such as cardiovascular disease and diabetes. Several factors were identified as contributing to the risk of long COVID, including older age, Black or Hispanic race, chronic diseases, hospitalization, and type of health insurance. The study highlights the need for coordinated approaches to treat and prevent long COVID in adults with serious mental illnesses. Avian flu detected in house mice, a new concern. In a surprising development, avian influenza has been detected in house mice in Grant County, Washington, likely linked to increased avian flu cases in wild birds in the same area. The U.S. Department of Agriculture's Animal and Plant Health Inspection Service, APHIS, reported that 6 house mice were collected on October 15 and tested positive for avian influenza. This finding is significant, as it represents a rare case of avian flu transmission to mammals. Grant County, located west of Spokane, has recently experienced 7 avian flu detections in wild birds, including ducks and waterfowl, on October 23. These detections coincide with a surge in avian influenza cases in both wild birds and commercial